Common stroke syndromes, again, it really, in terms of what you see with a stroke, really depends on what artery is blocked. But there are some more common syndromes than others. A middle cerebral artery syndrome. So there's three main arteries to the cerebrum, to the main part of the brain: the middle cerebral artery, the anterior cerebral artery, and the posterior cerebral artery. So a middle cerebral artery syndrome stroke often results in weakness of one side of the body, often affects the face, arm, and leg. So some of us have seen patients with kind of a drooping face and either weak or paralyzed arm and a weak leg on that side. And again, so if you have a right-sided stroke, the right side of the brain controls the left side of the body. So a right-sided middle cerebral artery stroke is going to cause weakness on that left side. If the stroke is on the left side of the brain, it'll cause weakness on the right. And since the left side of the brain controls language, if the left hemisphere is involved, often with a middle cerebral artery, you'll see language affected in some form or fashion. And middle cerebral artery is the most common type of ischemic stroke. Whoops. An anterior cerebral artery syndrome stroke primarily affects the leg. You can also see changes in personality and cognition, so the way the person thinks. And then posterior cerebral artery can cause changes in your vision, memory, and sensory impairment. Next slide. There's also something called lacunar stroke. A lacoon is actually a Latin word for small pit or a hollow cavity. And that's really what you see on a MRI or CAT scan, is like kind of small dark spots from a lacunar stroke. So they're very small typically. You have a blocked smaller artery that supplies a deeper portion of the brain, and you can get different symptoms depending on where the brain is affected. You can have just motor or just sensory. You typically don't have as much cognitive impairment with these deeper brain strokes. There's some very specific strokes, like, for example, one's called clumsy hand dysarthria syndrome, which is exactly that. Dysarthria means trouble speaking or kind of slurred speech. So they have difficulty speaking and weakness usually in that in the one hand on the affected side. Some can even have no symptoms. So some people don't realize they've had a small lacunar stroke, and maybe they have a CT of their head for some other reason. And then, you happen to see small lacunar stroke, but they had no idea. They have no symptoms that they're aware of. If you do find that, then certainly they are at risk for other strokes, so you still want to treat it in the same way once you find it. Vertebro-basilar syndrome is another stroke syndrome that affects the brainstem and cerebellum. So the brainstem is beneath the brain, where the cranial nerves, many of them come from, and the cerebellum is kind of the back behind the brain and controls balance and coordination. So when you have a stroke to this area and affects the cerebellar arteries, you can get dizziness, trouble swallowing, decreased coordination, you can have double vision.